Recovering from jaw surgery is challenging due to the impact it has on your sleep, on your diet, on your breathing, the limitations in communication. It's a tough surgery to recover from. As someone who went through double jaw surgery in August of 2023, I want to share with you the recovery timeline so you can go into it with the right expectation and be prepared for whatever comes your way. As difficult as recovery is, I can promise you right now I'm at 6.5 weeks and it's worth it. I can't speak for everybody, but I can promise that for me, this surgery was life-altering. Let's start with pre-surgery. I had to have braces for a full year and even have teeth pulled in order to prepare for surgery. You might have Invisalign or braces or something similar to prepare you for surgery. You can expect going to a maxillofacial surgeon at least a few times, likely to take a scan, an x-ray, as well as moldings of your mouth before surgery. Now let's jump forward to a few days before surgery. This is where you should prepare anything such as time off of work or school, making sure that you have someone to take care of you, making sure you have the nutrition and help that you need, all to prepare for surgery day. On surgery day, you almost always fast before surgery unless your surgeon says otherwise. This stage, it's normal to be anxious because you're about to go through a big operation and the recovery takes a while. And know that it's okay. Before you go into surgery, it'll feel like it's taking a long time, but in hindsight, it's all going to happen in a flash and you'll be waking up post-surgery in no time. I remember very little of the whole surgery day. Post-surgery, I was on a lot of morphine and I basically slept the first 18 hours after surgery. Now, you can expect to spend 2 to 3 days in the hospital where you basically just sit there, keep your mouth clean, and take a bunch of medication through the IV. I recommend having a few shows you enjoy. It's always nice to have visitors, but most of the care will likely be done by your healthcare provider. Then starts week 1 of recovery. You typically go home between 48 and 72 hours. Don't expect to move very much for the first week. You'll be on lots of medication, you'll be tired, fatigued, and for me the first week, I basically just sat in that chair. Eating is purely liquid and usually through a syringe. It's difficult, but you get used to it, and it's very normal to have a reduced appetite. I ate very little for the first week due to all the medication and recovering from the surgery and the trauma. I just wasn't hungry. Around day 6 and 7, you should start to have more strength and be able to return to some daily activities. This is when I was able to start walking and doing some real basic activity. Now, weeks 2 to 3, you start to improve a lot. Swelling starts to go down, consuming liquids and foods becomes a lot easier, sleep quality typically improves, and your pain goes down so you can get off strong painkillers. I recommend as soon as possible getting off opioids if you have them, because 1, you're going to have a tough time pooping. It takes all the water that would be going around town and pulls it right out, which means it doesn't leave, and when it does, not a fun experience. Yeah, it's not fun. I was able to return to work around day 10, and around day 14 to 15, I'd say I was close to 100% at work mentally. I work a remote job doing sales and marketing at a software company. This could be different for you based on your occupation. Woohoo! You made it to 1 month post-surgery, and typically around this time is when you get looser bands and you can start doing jaw exercises. Do them as soon as you can, because the more you're able to get them, the faster your healing goes from this point forward. You usually can start taking more soft foods, and your diet expands a bit more. By week 3, I was pretty much completely off, even over-the-counter pills such as ibuprofen and acetaminophen. Your energy should be more normal, numbness should start to decrease, and you might be able to start sleeping on your side as the pain decreases. Now, we're going to go through weeks 5 to 7. This is where life really starts to get closer to normal. I was able to start talking more, I could consume slightly more normal things. I was able to start things such as light jogging and weightlifting again. The stitches in my mouth fully dissolved, so I no longer had open wounds, and a lot of the numbness should be gone. Now, I'm at week 6.5. I still have a lot inside, especially up top from this double jaw surgery, but most other places are returning to normal. Usually, at week 6 or 8, you'll get your bands taken off or loosened again, so you can talk more, do more jaw exercises, and things just get even better. Now, the next phase starts at week 8, and maybe slightly sooner depending on when you get your bands off. At this point, you can start to return to a normal diet, but you still avoid really crunchy things. You can start to do most exercises that don't risk a direct blow, such as contact sports or things with balls. Wink, wink. Your chewing muscles will start to get stronger, and things will get a lot more comfortable. Most of the swelling should be gone, but just know it usually takes 4 to 6 months for all the swelling to disappear and your face to really settle in. Now, the next phase is from 8 to 12 weeks. And during this time, you should see gradual continual improvement as you start to go back to a normal diet. Swelling should be almost unnoticeable. You shouldn't have much soreness in your jaw, and any lingering numbness should continue to decrease. Now we're getting to the last phase, which is weeks 12 and beyond. From this point, you're pretty much cleared to do anything. You're usually returning to orthodontic treatment, and around months 3 to 4, you can start to ease your way into contact sports again. But be very careful, and it's always better to play it safe. As you creep towards 6 months, you should get back to complete normal with no dietary restrictions. Hopefully you're realizing the benefits of your surgery with better breathing, sleep, and anything else that might have affected you before. And your smile and face should be mostly done settling. So this is the timeline for orthognathic surgery. I hope it helps set expectations for what you can expect. But just know that if you recover a little faster or slower, it's not unusual at all. And make sure that you consult with your physician if you have any questions. As somebody who's gone through it myself, I know that it's challenging, but I know it's worth it and you can get through it. And if you are worried about something, let me know in the comments. Even if you just need a friend or somebody to talk to, let me know. I care about you. You're awesome.